Welcome back. Hopefully you watched my other videos. I have one from when I found out that I had thyroid cancer, as well as right after my surgery, a week after my surgery, and then just some tips for what to expect when you go in for surgery, and just some things to maybe bring that might help you out a little bit more, and like just different questions to ask, and just my experience with the whole surgery overall. I wanted to do a surgery, a video a month after, but it's just been crazy with 2 kids and living life. So it has been a little over 2 months. I had my surgery on April 12th of 2022, and today is June 20th of 2022. So you can see, it's definitely healing a little bit better. It's definitely still there. They said it would take about a year for it to kind of all go away. I sound a little hoarse, but that's because I'm kind of coming off of a cold. I would say my voice, for the most part, is back to normal, my speaking voice. I do notice that if I'm trying to get a higher decibel, like if I'm trying to like yell, my voice kind of like caps out. So like if I'm trying to get somebody's attention, far away, or if they're downstairs and like I'm yelling, like it just doesn't get as high as I want it to. And yeah, and like the doctor said that should come back within a year, so hopefully that will be good. I can't remember on my last one if I talked about I was having some shoulder issues. And now if you just have a regular thyroidectomy, it's like right here, you probably won't have any issues with your shoulders, because I had tumors that went farther up. There's a lot more nerves over here, so they did end up hitting a nerve and doing some damage to my left shoulder. But it's been about 2 months, and it seems to be going good now. For a while there, like if I was like working out, if I was on my stomach and trying to do like a Superman, like my right arm would go up just fine, but like my left arm, like I would get it like that far off the ground and it would just shake. I did do some acupuncture over there that helped bring blood circulation over, and I think that really did help a lot. She left like some dermals in there, which pretty much is your body sensing that there's a foreign object in you, so it sends more blood there to like push them out, and then that extra blood flow and whatnot helps with the nerve repair. So that's been helpful. I did that I think like 2 or 3 times. I haven't been able to go back because I recently went back to work for my maternity leave, so I haven't been able to do that as much as I would like to. Some other follow-ups, I did meet with my endocrinologist a couple weeks ago. She kind of went over my statistics for the cancer coming back, which was a lot higher than I anticipated. She said that there's a 40% chance that it's going to come back within the next 6 months to a year, which I was not expecting that. I just figured, well, I don't have a thyroid anymore. They got all the tumors out, which I ended up having 10 tumors that they took out, and like the biggest one was like 5.2 centimeters, I think. So she said that because of the amount I had and how big they were, how progressed it was, that's why my chances of it coming back are so high. When I asked the surgeon, he said I probably have had this for several years, because it is slow moving. So I might have had this before I even had my first child. So pretty much they brought up radioactive iodine, and I have chosen to not take that. Everybody, definitely talk to your doctors. It's a personal decision. But I would definitely recommend, before you just do whatever the doctor tells you to do your own research. Just some of the research that I have done on it, just some of the side effects don't really equal out what it will do. Like, it will literally make, so right now I have, it's like a 30 to 40% chance that it's going to come back. And if I did the radioactive iodine, it would do bring it down to 15 to 20% chance that it would come back. But there's also, then there's a side effect that you could get other cancers. So like my chances of like breast cancer, stuff like that would go up because you're exposed to this radiation. Which, I mean, it doesn't just attack your thyroid. It is supposed to just attack your thyroid, the thyroid hormones in cancer, but yeah, it's something I bet it can give you other cancers. It can cause you to have salivatory issues, so you can't like swallow. It can make you have like a permanent bad taste in your mouth. And then kind of like the big deal breaker for me was that I would have to be away from my children for 21 days, which if you watch my previous videos, I have a 5.5-month-old, so that, and I'm exclusively nursing, so I'm like, that's not going to happen. And then even if I didn't have kids, you still had to be away from people for like, I think it's like a week. And you had to like isolate yourself, and you had to like bleach your toilet water, and it's just, I don't know, like all of it just didn't seem worth it to me to do that. Like, I mean, down the road, if like this cancer just like keeps coming back like year after year after year, and it gets worse and something like that, then maybe I'll explore it a little bit more in depthly, but just right where I'm at with my life and being a mom, it just isn't a good fit for me. But definitely, if that's something that you want to consider, I just recommend doing your own research on that and definitely talking to your doctor. As far as the levothyroxine, I'm on 100 milligrams. 100 milligrams, 100 mcgs of that. And honestly, it's been going really good. Like, I'm very surprised and pleasantly surprised how good it's going. I actually think I'm more awake or alert than I was before. Like, I felt like I was more groggy and tired and fatigued before I went on levothyroxine. So that is a pleasant surprise. I have definitely been able to tell that there's been more hair fallout, which is hard to really tell which is that and what is just my postpartum hair loss, because again, I'm 5.5 months postpartum, and I know I lost a lot of hair around this time with my first child. But yeah, it's a lot. Like when I'm brushing my hair in the shower, like I wouldn't say it comes out in clumps, but like if I like go like this, I definitely get hair. But they do say that it only lasts about 6 weeks, so I'm hoping in a couple of weeks that will level out a little bit, since I've been on it for about that long now. So that as far as weight gain goes, again, I'm exclusively nursing, so I am burning a lot of calories that way, but I've actually have lost like 10 pounds since my surgery. I went in, I was 130 pounds, and now I'm right around like 119, 120. Now obviously it's only been 2 months, so that could definitely change over the next couple months as I'm eating more, stuff like that, but I really don't feel like my appetite is that much more than it was before. Again, with nursing, I do feel like I'm eating a little bit more maybe, but not really, and I'm just making sure I'm making smart choices that when I am hungry and I want a snack, like I'm eating like almonds or apples, and I make sure to have a full breakfast with oatmeal for breakfast, and try to have a good lunch and dinner, and then just leftovers for that. So I'm just still trying to eat healthy. I'm not working out too heavily. I do like mainly just like yoga, some Pilates. I walk a little bit, but nothing crazy. Especially with going back to work, I really haven't been working out as much as I was when I was on maternity leave. So that's definitely something I'm going to monitor, and I will try to update on here just like kind of what my journey is and what I've been doing to help with that, because even if it does sound vain, it is definitely a concern of mine. Like, I don't, I've always been relatively a healthy weight my whole life, and I want to keep it that way, and I know I might need to work a little bit harder at it now, but definitely something I'm even monitoring. As far as the scar goes, I haven't been doing too much with it. Like, the surgeon did say I could do like tissue massages, just because like I asked him at my last appointment, because I still can't like fully lift up. Like, it's still like it feels tight when I do that. And my husband's like 6'4", so it's like, and I'm 5'5", so it's like I want to be able to lift up, and I'm like, did you guys like am I always gonna be like that because there's like less skin there, because obviously they cut and they like fold it so you have a little bit less skin. And I already had, it's like a cleft palate, a paraband syndrome, so my jaw's already, like, a little bit rescinded and, like, tight. So I'm like, oh, geez, I'm not going to be able to lift. But he said that's perfectly normal and that it does, again, take about a year. He made a good point that although it looks very nice and clean on the outside, a lot happened on the inside, and there's still a lot of scar tissue. And I can even still feel like it's still a little, like, swollen here. I am getting, like, feeling back, which is sometimes sometimes bad. My little one likes to grab at it sometimes, which I can definitely feel that. But definitely getting feeling back. It's still a little numb, like, right here. I can feel that I'm doing that, but it's not, like, I don't know, it's, like, almost, like, sore, I guess, when I do that. It feels like it's, like, bruised still. And I don't know if you've watched, like, don't do it until after the surgery, but I did watch, like, some videos of a thyroidectomy happening, and yeah, it's a lot. Like, they're, like, literally, like, taking a little, like, cauterizer and, like, getting all this stuff out. So yeah, it's not really, once I realized that, like, yeah, it makes sense that I still don't have full movement, because it's still healing. I think that so often, like, even, like, when having a baby, you're like, oh, you look good on the outside, so you must be healed, but the inside of your body is still taking time to heal. So just be compassionate with yourself and give yourself some grace with your healing process. It is obviously summer, so I'm going outside a lot. What I've been using for sunscreen on here is I've been using this. It's Neutrogena Invisible Daily Defense. I was really looking for an invisible sunscreen because I would, like, put the white stuff on, and, like, I don't know why, but, like, my neck just, like, won't absorb it. So, like, I would put it on and I would just have, like, a white, like, strip across my neck, like, all the time, and then it would, like, get in, like, the little grooves of the scar, and it was just, I've been using this. Just make sure that you get broad spectrum, so it does both the rays, because that's important. But this is great. Like, it's kind of like orangey, like you can kind of tell it's like an orange color, but when you blend it in, you can't see it. So it's really, like, it's really nice that you can just kind of, like, blend it into it, and then go outside. And then I usually just bring this with if I'm going to be outside for a long time, and apply it, like, every, like, hour or so, just to kind of protect it. I know a lot of people, they'll, like, wear, like, scarves and stuff, but, like, I don't know, I don't want to be out on the lake with a scarf. And I thought about doing, like, a Band-Aid across it. Like, I don't know, like, if I'm going to be out, if I know I'm going to be out for a long time, I might do that, like, just get, like, a big Band-Aid. But we'll kind of see. Right now, I think this is working pretty good. It's 30 SPF, so it's pretty good. And then what I've been doing in the morning and at night is I've been putting this on. It's Derma E Scar Gel. So it's like a clear gel that I just take a warm wet washcloth and just, like, wipe it off, especially if I have, like, sunscreen or anything on it, just to kind of wash it while I'm washing my face, and then I just apply that morning and night. And like I said, like, I think it's, I mean, again, it's only been 2 months, so I still have a long ways to go, but it definitely keeps it moisturized and keeps the mobility of it going, which I really like. So yeah, so I wanted to talk about that I was doing, hair, weight, throat, again, still recovering from that. One thing I do want to recommend is I'm kind of, like, I made a couple of notes that are just things I wanted to go over, but it's definitely not in order. If you have just found out that you have thyroid cancer and, like, you're kind of just facing it and going through the roller coasters of it, I definitely recommend not joining Facebook support groups. I just feel like when I was in it, I was so depressed because, like, it was just people just saying how bad the reaction is. People, like, taking photos of the before and after photos of, like, you know, this was me a year ago and now I'm, like, 150 pounds more, and, like, so much stuff that it just puts you in a bad headspace and you just think that's going to be you. And, I mean, don't get me wrong, I feel really bad for those individuals who haven't gotten their doses right, and I'm sure I'll have to adjust mine as time goes on. But it's not good for your psyche to just be scrolling through your Facebook feed or whatever feed you're on and, like, constantly just seeing people complaining about their health and, like, their weights. And like anything else. Like every body is different, so don't read all that, because that's what I did. I went through and I like saw all this stuff, and I'm like, oh my gosh, I'm gonna have this surgery, I'm gonna gain so much weight, all my hair is gonna fall out, I'm gonna be groggy, I'm not gonna be able to play with my kids. Like I saw, like there was a post that like this woman was like, I can't get out of bed to go play with my kids, and it's all because of my thyroid and this medicine. And it's like, well, then your medicine's not working. Because again, like I feel just as good, if not better, than when I wasn't in surgery, and that's, before I had the surgery. And that's why I'm making these videos, because I couldn't find anything like this. Like all I could find was negative stuff, and so I want to give anyone out there that is very, looking down the barrel of this gun of cancer and like having to do surgery, and just let you know that there is hope. And yeah, this might be some bad stuff that might happen, but just do your research, find a good surgeon, advocate for yourself. And it's gonna be okay. Like, I'm again so surprised of like how good this is, and like even my last blood work that came back, like my thyroid levels, I'm on my phone. My thyroid levels are very, very low, because I keep them low. I think she said at least for the first year, if not for the first 5 years. Because you have such a higher chance of cancer coming back, they keep the thyroid level low, because obviously if you're creating that thyroid hormone, or the pill is creating that thyroid hormone, it can produce the cancerous cells. So mine's like super low. And like if you like see the bar grid, it's like this is where like a normal thyroid's supposed to be, and I'm like here. But again, like they know what they're doing, because like obviously like I'm not feeling bad. I mean, like if my thyroid wasn't doing, not my thyroid, the medication wasn't doing what it was supposed to be doing, I would be groggy, I would be tired, I would have brain fog. And like this is me talking with I have 2 kids, a 3-year-old and a 5.5-month-old, and I'm like, I'm feeling pretty good. Like, so like just be aware with what you put into your brain. Self-reflect. Do your research. Maybe in my next video I'll post, I have a book that I read that it's actually by an endocrinologist, and he talked about how like doctors sometimes are just like very like black and white to the point, but then he got diagnosed with like a heart issue, and he like it made it very real for him that like, oh, I'm actually working with human beings. Like I'm not just looking at blood charts and like, okay, this is where you need to be. It was very personable, and he like had a lot of good information about like what to expect in the surgery, the radioactive iodine, stuff like that. So I will either if I figure out how to do the description and stuff, I'll try to add that into the description below, or when I make an update video, again, I will put that in. So I don't know when the next video is going to be, but I will continuously try to update on here just how I'm doing my journey, let you know that there is hope, that not everybody that has thyroid surgery or is on thyroid medication has tons of issues. I mean, obviously there is, but there is hope out there, and there is good things that happen. So I think that is everything that I had. I don't know who's all get to see these or not, but if you do have questions, comments, want me to talk about anything else, please just put a comment below, or if you, I don't know if you can like direct message me. I'm still learning all of this stuff. Again, I just wanted to make these videos, hopefully to help somebody out there that's going through the same thing that I've gone through. So that is all I have today. So thank you for watching, and have a great day.